Namaskar, this is Pia Jyoti Katru on ITV Gold, and today we have a very special guest with us who is a senior research scholar and has treated 100,000 patients of vitiligo in last 35 years. He is the first Indian to get research award at World Homeopathic Congress, Italy, and also he is honored as Doctor of the Year from Asia Books of Records. So let's welcome Dr. Mahendra Kabra to ITV Gold. Namaskar, Doctor. How are you today?
Namaskar, thank you. I'm fine. How about you?
I am doing wonderful. It's like a pleasure talking to you and knowing more about you. So, before we get all the valuable information from you, Doctor, I know you have declined a lot of offers from world's most reputed homeopathic hospital in UK. So, tell me, how do you feel about all that?
In fact, it gives me immense satisfaction to be here. And the reason behind declining was that I had so many thousand patients here, and it wasn't possible to let them like that.
Mm-hmm.
And in those days, internet and smartphones were not there, but we started visiting England and we visited many dozen times. And then with the era of smartphone and internet, then everything became easy, and it doesn't matter where I stay. We could
Mm-hmm.
serve globally from the small place like Jalgaon in India near Mumbai.
Uh-huh. So tell me, let's talk about, what you are good at. We see like different looking faint patches sometimes on the skin. A lot of people do see them. And so tell me, how can one differentiate between vitiligo and other skin diseases?
See, vitiligo is one of the disease or disorder uh, whose diagnosis can be made even by the patient at
Hmm.
home.
Hmm.
The milky white patch is of vitiligo.
Acha.
There are many types like fungal, vitamin deficiency, and allergies, and so many things, psoriasis, but due to worms also. But
Hmm.
milky white is vitiligo.
Hmm.
Yeah.
So tell me, like I have heard, a lot of people talk and they say that, even vitiligo, it has lot of types. So tell me, are those all those types curable?
Yes, in fact, vitiligo of all types is definitely amenable to the treatment,
Hmm.
and success rate is very high.
So what are the types? What do you see usually?
There are two major types.
Hmm.
First is generalized vitiligo, and
Hmm.
another is focal, that is segmental. These
Hmm.
are the two main types.
Hmm.
So, general vitiligo is
Hmm.
almost bilaterally symmetrical, like butterfly-like lesions, similar on both sides, and
Acha.
segmental is one-sided, as the name suggests.
Hmm.
Segmental is little stubborn, but yes, it is also amenable. And there
Hmm.
are many subtypes like lip and fingertip kind of
Hmm.
thing.
Hmm.
Then graying of hairs is there.
Hmm.
Congen- inherited kind of vitiligos. All are uh, definitely they respond to this kind of research and treatment.
Tell me, I know you see a lot of patients, and I know there are so many, like, celebrities, even they have suffered and still are suffering from this disease. So I'm just curious to know about your research and treatment.
Yes, absolutely. See, no skin disease is a skin disease.
Hmm.
Uh, in real sense, the internal toxins, due to some reasons, some causes,
Hmm.
this internal toxicity is eliminated through the skin to save the life or to save the important organs.
Hmm.
It is like the opening of emergency valve of a pressure cooker.
Hmm.
So if valve does not open, then blast can take place.
Right.
So I can say that skin goes worse and person gets better.
Hmm.
The person who gets skin disease, vitiligo or any kind of skin disease, he is medically fortunate. His life is saved. So
Right.
it is really a internal disorder, and that disorder comes out through the skin. Toxins come out through the skin, and in case of vitiligo, the melanocytes are damaged
Hmm.
because of the at the exit point of those toxins, melanocytes are damaged and
Hmm.
melanin pigment formation stops, and that area becomes discolored.
Hmm.
So it is essentially a internal problem.
Hmm.
So just oral medicine is given for the
Hmm.
consumption, and there is nothing to apply on skin. In
Hmm.
other treatments, majority of the treatments, the sunlight or ultraviolet light exposure is essential or recommended, but in
Hmm.
our treatment just oral homeopathic medicine in LM potency, and that will take care of the those patches.
Hmm. So is there like a success in the sense like how much time does it take and what is the success rate?
Yes, in fact, patients are really anxious to know the means they want rapid cure. Yes, it is possible in many types, means early stages, and
Hmm.
when these lesions are there on the thin skin area where blood
Hmm.
supply is also good,
Hmm.
then in early phases it is possible to do it in few months. But
Yes.
when it comes to the advanced and widespread, and
Hmm.
especially when it is there on lips and fingertips and joints,
Hmm.
then it takes time.
Hmm.
So few months to few years we can say. But
Wow.
one interesting observation, as you said, we treated so many thousand patients, and patients from all stratas and different countries, more than 125 countries. So we can say that mind and body fitness matters when the duration, question of duration comes.
Hmm.
Uh, Stronger the body and
Hmm.
better the mindset, then such patients respond very quickly. Means even at the speed of magic, means magical recovery in means laborers, sports champions, and
Hmm.
those who take good care of health,
Hmm.
sweating out kind of lifestyle, then such patients, especially rural patients, farmers, and hard workers, they
Hmm.
respond magically.
Hmm. Hmm. So basically, doctor, you're saying that, it's very important to take care of yourself, then only this disease will be healed properly.
Yeah, and we always guide our patients
Hmm.
about fitness because uh, we maintain our own health in good way, in
Hmm.
special way.
Hmm.
I'll be happy to share you that I am reduced by 25 kilos.
Wow, that is
Many of
amazing.
my family, yeah, yeah,
Hmm.
and maintaining since 30 years, and
Hmm.
I am able to lift 180 kilos even today.
Wow. And I think we all need to get tips from you around that, what to do and what not to do.
Always, always. I'll be happy to do that. So, how to
Absolutely.
breathe, diet, lifestyle, I can
Hmm.
tell you in four words:
Hmm.
ahar, vihar, achar, and vichar.
Hmm.
These four things we preach very lucidly in
Hmm.
easy to do way in the
Hmm.
busy lifestyle,
Hmm.
and along with medicine and this advice, we
Hmm.
help them to come out of this unfortunate malady, which they around 2% of the population gets afflicted.
Hmm. Hmm. I definitely do have to say you are a total health guru, and definitely with all the treatment and everything else, you definitely have, and I'm sure considerably reduced the disease burden in the society in the last 4 decades. So tell me, doctor, what is the success rate?
Oh, success rate is very good
Hmm.
because we have been treating uh, vitiligo patients. Majority of our patients come from vitiligo
Hmm.
uh, and class,
Hmm.
and so uh, I can tell you in one sentence, the person who knows more and more about less and less is called super specialist. So,
Right.
attending so many thousand patients, more than 100,000 patients of vitiligo, the first one was cured in 1987. So,
Hmm.
success rate is very good, and the patient can see the change.
Hmm.
Our patient can see the change in first few days or first few weeks,
Hmm.
excepting some widespread kind of vitiligos.
Hmm. Hmm.
So it is something like super experience, and
Hmm.
uh, I'll tell you the definition of specialist. The person who knows more and more about less and less is called
Hmm.
specialist.
Right.
So that gives us upper age, and it is very rare to come across the failure in our research institute.
Hmm. Hmm. So tell me, like, are there any like side effects from all this treatment?
It's a very good question. As I said initially, that skin diseases are not skin diseases.
Hmm.
They are the outcome of the internal disorder. And
Hmm.
these internal disorders are only three.
Hmm.
So we diagnose those internal disorders which are responsible for all health problems,
Hmm.
chronic health problems, permanent health problems.
Hmm.
So patient thinks that we are treating vitiligo
Hmm.
or skin disease, but we are treating the internal fundamental disorder,
Hmm.
which
Hmm.
is responsible for other health problems also.
Hmm.
So if a person is suffering from constipation or thyroid disorder, which is very common with vitiligo,
Hmm.
or arthritis, or anything, allergy, asthma,
Hmm.
psoriasis, eczema,
Hmm.
anything along with vitiligo, then most of other health problems also get relieved because the root cause is being attended.
Hmm. Hmm. Hmm.
I'll quote two examples here.
Hmm.
One patient was suffering from bad constipation,
Hmm.
and he was required to take some Ayurvedic surna every day,
Hmm.
and with our vitiligo treatment, his constipation got well.
Hmm.
One more patient of constipation, I remember, a Bangladeshi boy from England,
Hmm.
and he was operated for constipation twice, and he developed vitiligo also. We assured them that most probably constipation will also go away, and it happened. Now,
Hmm.
one top example of side benefits, which we call,
Hmm.
uh, an accounting officer of one Delhi in India,
Hmm.
major leading Delhi.
Hmm.
He came, landed in our clinic with his wife for vitiligo, and on inquiry, on case taking, they mentioned that that was a married couple for 17 years, and
Hmm.
uh, there was no pregnancy, no conception. Uh, and then, after knowing the reports, we felt that yes, it is possible. And with the we assured them on first day that yes, it is possible, and it happened.
Hmm.
Vitiligo and conception, both problems solved.
Wow. Wow.
And there are many thousands and thousands of examples of such kind. Uh, a patient in UK, she had asthma also, and in such a
Hmm.
rough weather, it got well. One Mrs. Sharma in England. We have visited England, although we have many patients in US also. But
Hmm.
being visited, Mrs. Sharma had asthma, allergy, thyroid. Her allergy was so bad that if she cuts lemon, she used to get thousands of sneezes.
Wow.
And if she
Wow.
looks at tomato, then eyes would go red.
Wow.
Gradually and successfully, all of other health problems got resolved, and even thyroid tablet was stopped as
Mm.
per the advice of the
Mm.
specialist uh, from the hospitals. And
Wow.
both were astonished. Even that English doctor was astonished that
Yeah.
yes, it does not normally happen.
Wow. Wow. And
There
looks
are
like,
there are
it definitely it is a global problem and of course a challenge too, who suffers from it. So tell us, Dr. Mahendra Kabra, how can a person, staying long distance, how can they get the treatment from you?
Yes. Uh, See, by God's grace, the treatment is so well. We got to treat so many patients, so we have vast experience. So there is
Mm.
no need to travel. Um, just sharing the photographs and then going for a video call, video examination is more than sufficient,
Mm.
and the medicines can be couriered to the address of the patient.
Mhm. So, how can they get in touch with you? How can they do that? Is there a
We will
website?
share our email ID, our WhatsApp number, and all, and
Hmm.
website.
Hmm.
Uh, and the treatment is not at all, it's very convenient to start
Okay.
and finish.
Okay.
One thing I forgot to mention, that the results are very stable.
Hmm. Hmm.
Patients are Vitiligo is most stressful skin disease,
Hmm. Hmm.
skin disorder, I should say, and so on the day of stoppage of the treatment, patient or in case of kids,
Hmm.
parents are very much anxious that it should not come back because it happens with other treatments where
Hmm.
there is an external application. So they are very anxious that it should not come back. It should not come back. They are ready to continue the treatment for whole life.
Wow.
But we most human in the human way assure them that once it is gone with our treatment, it is extremely rare to get it back, and if it happens, then
Hmm.
recurrence will be treated free of charge.
Wow. But does it? Do you think it can recur?
No, it is extremely rare. It is
Okay.
extremely rare.
No, okay, okay. No,
Yeah.
but I think it's like amazing how you have treated so many patients and done such a wonderful job. And definitely, if you have any other thing you want to give a message out to our ITV Gold viewers, please go ahead and do so.
Yeah, it is God's wish that this agony, this most stressful disease, uh, is now really amenable to the treatment, and the incurability as per dictionary, medical dictionary, that has become the history now. So there is no need to worry. Yes, vitiligo patients can lead the normal life, and they can enjoy their life again.
Thank you so much. And I definitely want to wish you all the best. And definitely, we will one more time, talk to you next time. When we get to talk to you, we will talk about all other health aspects and get the tips from you. Thank you so much.
Thanks for the invitation.
Thank you.